So, hi, good morning. So, I'm gonna perform an oral care. So, first and foremost, of course, we have to introduce ourselves. Make sure we wash our hands already from the outside. Make sure we introduce ourselves to the patient, explain to them what's the purpose of this. And then, once inside, we also make sure we wear gloves, even a mask, and also, if possible, appropriate, we can wear also an eye goggles. And then, once inside, we also have to gather all the necessary supplies, such as all these. And then with the suction bottle, assuming I already wear my standard precautions, we have to hook it up on the wall. And then when we hook it up, make sure we set the appropriate pressure, especially for adults at negative 100 to negative 120. And then before we do our oral cares, make sure, especially if assuming the ET is in me inside, we have to check what's the appropriate level or the stand lip level. Make sure it's secured. Inspect also inside of the patient's mouth if there are any trauma, any inflammation, or any ulcerations. And then once everything is all set, we will start it by having this inserted up on this junker, and then hook it up on the wall, assuming. And then once you hook it up on the wall, we have to turn it on. Make sure it's secured tight, not loosen up, to prevent from any being fall down. And then another important thing to note is that when we do oral cares, we can also either put it up with a towel on the patient's chest, especially if there are any pulling of secretions. It will prevent from the secretions being exposed to the patient's body. And then assuming when we insert it up in the patient's mouth, we have to suction it inside the patient's mouth. Make sure we prevent from pulling of secretions or from any aspiration the patient is being experienced. So after suctioning it, make sure if this ET is an ET holder, we have to shift it up on the other side and then suction it also on the other side. We also have to ensure that the ET tube also itself, we have to try to suction it up a little bit if there are any secretions that being stick up on the tube. So after we do this, we have to put it up back on a safety bag. Make sure that it's clean. And then usually when we do oral cares, we have to do it every 2 hours. So assuming after 2 hours, we're gonna do it with this another set. So right here, we have to gather all these supplies. So we have to hook it up first, this one on this, and then we have to put this oral agent. So when we do this oral agent, we also have to try to suction or insert it inside to the patient's mouth, especially on the gums and even on the palate and even on the tongue. So never push it too deeply to prevent from any gag reflex of the patient. So after doing this, we have also to make sure we have this brush over here. So with this, we cannot insert it to the suction itself. So we have to put some moisturizer. Make sure that it's not being clumped. We can try to put it in this whole thing, and then make sure we insert it, and then try to moisturize the gums, the palate, the tongue, and even most of all the lips to prevent from any dryness. And then every time we do this, we have to try to change it up from other side, so that to make sure that this other side is being prevent from any pressure source, which is important. So after this, we have to dispose it everything. Make sure that it's disposed. And then after 2 hours, again, the third attempt we're gonna do our oral care is with a toothbrush. So with this toothbrush, we have to prepare also the necessary supplies. So we have here the brush itself. And then the moisturizer. So with the brush, we have to insert it again in this one. Make sure we have to insert it in the wall also with the appropriate suction pressure of negative 100 to negative 120 for adults. And then we have the anti-plaque solution. Make sure it's not too much at all. And then we have to brush it in the patient's mouth. make sure when we brush it carefully, make sure in a circular motion or in a upside down, and then we have to brush it like assuming we brush it by ourselves. So after brushing is one, make sure we dispose it up, and then we have this thing also. We have to put some moisturizer